Ocala's information station, 1370 WOCA. Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in this Thursday morning. Robin, remember when we were participating in the Strawberry Festival for Habitat for Humanity? There was a recording artist who was performing there. He was a veteran who was wounded, and I can't remember what happened to him, but he was paralyzed from his waist down, remember?
Yes, he was.
And then somebody said, there's a doctor who has an amazing procedure, and, long story short, he was on that stage, standing, singing, dancing. Somebody knew what they were doing, and it was almost like a miracle to see this. And so when you think about somebody like Christopher Reeves, who basically was in an accident and was paralyzed from the neck down for the rest of his life once that happened, and you think, well, maybe there's hope in the future for anybody who gets these kind of injuries. It's very encouraging. Whether it's that serious or something still along your spine, we have Dr. Ranjit Gowda in the studio. He is a guest of Leah Caruso. Leah is a friend of the station, and of course she's with Strive Rehabilitation, and has brought us some amazing guests in the past. And right now we're going to meet another amazing guest. Thank you, Leah, for doing that, by the way.
Thank you for having us.
How are you doing?
I'm good.
On the air? I know I asked you off the air, but it's a good on-the-air question as well. So Dr. Gowda is an American board-certified physician in physical medicine and rehabilitation and in interventional pain management, and is a physician with Strive Pain and Spine Center, which is brand new, which doesn't even have the name on the building yet, right?
Right.
If I understand that right? Okay, all right. Dr. Ranjit Gowda, good morning, doctor.
Good morning, Larry. Thank you for having us up here.
Nice to meet you.
You as well.
And in what I just described, are they rare for somebody to be able to actually have a spinal injury that has caused paralysis to be reversed like that? That almost sounds like a miracle, but is it rare, or does it happen more often than I realize?
You're absolutely right. It does happen more often lately with all the advances in technology.
Wow.
But you brought up a very good point with Christopher Reeves. I think one of the things, though, that it still remains a medical challenge in the field is Christopher Reeves, as we all remember, was a very high spinal cord injury, and that still remains a hard challenge to when it's near complete or total with how the body's neurologic system is set up, versus if we had a more, what we would say, every injury is unfortunate, but a more lucky injury lower down in the spine,
right,
then, and especially with today's care with spinal cord injury, complete reversal is such an amazing journey and such a proud moment for medicine and for the society and the rehab team as well, to return them to full, as you said, dancing on the stage.
Right,
and that's,
this guy was.
What an empowerment, and that's exactly what our field stands for, and it says physical medicine and rehabilitation, and that rehabilitation actually, the word that we meant, trying to take a person back to their fullest normalcy or functioning possible, or return back to where we started, where with full function and activity. And I think back 15th century, they just adopted that word, but it meant exactly somebody being redeemed back to normal.
Oh, really?
It was more a religious term to start with, but in a physical sense, it's being returned back to normal.
Good point, yeah. Do you know what, I need a spinal 101, because I don't know this. What's the difference between the spinal cord and the spine? Or is there no difference?
No, that's a very good question. Spinal cord, spine, generally a spine would mean all of the contents of the spine and its contents, and I don't think medically anybody makes a differentiation as such. But the spinal cord would be purely the neurologic content, the inside part, the actual nerve connections inside the spine. Spine is a bony structure with the nerves and the blood vessels and all the structures.
Okay, and is it an enclosed tube?
It is an enclosed tube, and it starts off at the base of the skull and all the way to the tailbone would constitute the spine with 7 neck vertebrae, and that in most mammals that'd be a giraffe or a human being, and 12 of the chest vertebrae, the thoracic vertebrae, and the 5 lumbar, and of course we have the tailbone, which is 5 vertebrae combined, and we hear the word coccyx. These constitutes the regions of the spine, and the inside of the spine has nerves, blood vessels, but the spinal cord runs inside. It doesn't run the entire length, but it stops somewhere at where we would say at the bottom of the chest vertebrae to the.
Oh, really?
But the rest of its nerve connections, like telephone wires, runs down. And a spinal cord, in a sense, is set up like a brain structure. So the actual spinal cord, we should think as just the body part of the brain, because it's got the gray matter and the white matter. So it's more like a neurologic control center.
Oh.
Yeah, it's more than just nerves. It's really actually, it's as though we have one brain, the intracranial or within the head, and the other part, the rest of the brain still continues on down. That's why it's such a critical structure. As you said in Christopher Reeves, when it gets injured very high up, it's like almost as though we had, a brain neurologic injury rather than just nerve injury or.
So if we hurt our foot, obviously the end of the spinal cord is a distance away from our foot, but somehow that pain makes it to the spinal cord, which then we feel it. So in your work, when you're dealing with pain, does it have to do somehow with, I don't know a better way to ask this, maybe a wiring or something?
Absolutely. And that is, it's amazing. It's like you read up on everything about pain.
I just stubbed my toe a lot. I'm just
classic description of pain, the pictures we have, and we have from historical, it shows a typical caricature of a man with something stuck in the throat, and trying to explain the process of pain is beyond just the toe or the foot. The message is carried out from the toe, would go along the normal nerves we all understand, and it'd be the leg here in this case, would enter the spinal cord at whichever level is designated to enter. Each one has its own specific level, and raises up the spinal cord. The message would finally go to the brain, where it would be recognized, oh, I've been stuck with a pin or something's hurting. The ouch doesn't come until it goes to the brain, the signal, because that's what interprets, okay, this is pain, or this is a tickle, or this is a light touch, or this is just a normal person walking. And that's called the pain pathway. And then on the response from the brain comes about, whether it be emotional, as in, oh, I hurt, or okay, we got to quickly move this foot away from the fire or the pin. So it sends the signals back to the muscles all along the same pathway to remove the limb or quickly withdraw it, which in which case we would call it a reflex.
Right, and that right there is, I've often wondered this, when we have something that kills pain, or whether it's, I don't know, because a nerve has been damaged or cut, or because we have maybe some kind of a medicine. I always think that's actually a bad thing. Not that we want to have pain, but if we don't have the feeling, we're going to not know to have that reflex or to pull the foot away from the fire, as you said.
That's true. That's very true. And actually, that's where the differentiation comes about. And what then pain is a very important biologic reflex. It's without our nerve supply, we probably would slowly lose our fingertips, arms, and that's typically what happened with, and we all remember we don't have leprosy anymore, and we remember in leprosy patients would be shown as tattered limbs, and in modern day, diabetes has in some way come to replace that, because we see people lose appetite.
I never made that connection.
Right, because without the protective reflex, we would be burning our fingers on hot coffee or poking and not realize that it's being injured. So that part of the pain is very important. And the part where we deal with pain management, or we all know that there's a lot of physicians trying to treat pain, and where that comes about is where there's an undue or beyond the normal healing period, we call it. We expect an injury with the pain, we would expect it to be a day or a week or a few weeks after post-surgery. But if we have pain 5 years down the road, we know at this point it's no more protective versus a nonsense, or we call it a nuisance pain.
Right.
So when it extends beyond the perception of pain, even without anything being injured any further at that, there's nothing, as in the case we talked about the toe, the poke is gone. It could be a frostbite, for example, for World War II veteran, and they could still be hurting today, but it's not that they're having any ongoing frostbite because the pain pathways have been set up. So in that case, it doesn't help or protect the person anyway, other than cause dysfunction and difficulty and emotional distress from the pain.
When a person injures themselves, and then we hear stories that they have to learn how to walk all over again, are those nerves sleeping, and are those the same nerves that enable a baby to learn how to walk? Do the nerves of the spine wake up when the baby starts wanting to learn to walk?
Yeah, that's it's a very interesting aspect, especially with modern medicine. About I think you bring up a good point of what part is new learning versus neuroplasticity, we call it. Mm-hmm. Are we creating new nerves or the old nerves being trained? For the longest time, we believe that we are born with the nerves we have. They get pruned down or cut down, and the baby has the most number of neurons because it goes through a tremendous learning period. And actually, by age 7 or past that, most of the neurons we don't need for long-term functioning have been pruned out, or unnecessary ones. So it does learn in a different way, but it learns. A baby's learning process is where new things, that prior experience hasn't been there, but the programs for that we somehow believe exist already at birth, but so they have sort of like having a big block of ice, and you chip away and make a beautiful ice sculpture, but you take that same beautiful ice sculpture is what we're left with, and now you cut away a limb. So the part that has to be some sort of gluing needs to happen because we're not left with that whole new block of ice. So, but we do believe nerves are capable, that other nerves can learn the function of the ones that were lost. That's what we call retraining.
Oh, really?
Yeah.
Does that happen naturally, or does a doctor have to? It does
happen naturally. And we see this typically after somebody who's, we believe, has had stroke or what we call a cerebrovascular accident, and we learn the language back. Some of the connections are made, but some of the techniques are start using other parts of the brain to help function the ones that we lost. And that's part of rehabilitation, where we are aware of the neural recovery process, how we can use different reflexes and different things to circumvent the shortage. And typically, like, we lose a limb, the other one strengthens up to make up for the one that we lost. And so rehabilitation also comes from the point of, what do we have left? What can we strengthen to help we may have that limb that may recover, or we may not have that limb as an amputation, but how do we make the rest of the body function and make do, or more than make do in certain cases, where people have now demonstrated they can go up to the top of the Himalayas or do mountain climbing even without bilateral lower limb amputation, with prostheses and the appropriate, and trying to run in.
It's amazing,
Olympic and trying to, you've been through all the controversy where they want to compete with able-bodied, and committees have had problem with, should we consider them able-bodied? But that's a societal question.
Absolutely, it certainly is. Boy, Leah, you brought us some really great guests in the past, and you continue. What is the conversation like between you two in the car? That's what I want to know. All right, we'll take a little break and be right back. Dr. Ranjit Gowda is here if you want to call in. You are welcome to. The number 622-9622. Leah Caruso also here from Strive Rehabilitation. And Dr. Gowda is at Strive Pain and Spine Center. We're going to find out more about what they do over there in just a second. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, times of clouds and sun with a shower or thunderstorm around in the afternoon and evening. The high 85 on the coast, 91 well inland, and partly cloudy overnight, those 68 inland, 73 on the coast. For tomorrow, a mix of sun and clouds with a shower or thunderstorm mainly during the afternoon hours, high 86 to 90. It'll be partly sunny Saturday with a chance for shower and thunderstorm, high 86 to 90. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
If you're anything like I was, the thought of getting older was the last thing on your mind. But here we are. For me, it started slowly. The lack of energy, never being in the mood. And when I was, I could never perform at my best. I tried the pills and other treatments with minimal results, and all but given up on my sex life. Then I found the doctors at New Male Medical Center. Wow, they made a new male out of me. Feel like I'm 25 again. I have renewed vigor, so much more energy, and no longer worry about my performance. New Male treated me like my situation was one of a kind, with a custom treatment plan that really works. I feel great. They can create create one for you too. It does not matter if you suffer from low testosterone, erectile dysfunction, or just want to last longer. New Male will help you.
Call New Male Medical Center today at 352-404-4779. 352-404-4779. That's 352-404-4779. It will change your life. 352-404-4779. La Famiglia Pizzeria has moved into Ocala. Stop by today at 2504 Southeast 17th Street and see for yourself what everyone is talking about.
Awesome place. I never get pizza anywhere else.
Great New York style pizza and dishes.
Best pizza in Ocala.
One trip and you'll agree, La Famiglia Pizzeria is the best. La Famiglia Pizzeria. Stop by for a pizza that you'll love or call in and order yours for pickup. 352-245-2419. La Famiglia Pizzeria.
Stay informed on everything going on in the villages with the Village Spectator newspaper. The Village Spectator is exclusively devoted to the villages with news, commentary, and more. And yes, they have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company that fits your needs, and all we ask is that you tell them where you heard about them. Call Tom's Picks at 804-1223 and pick up your copy of the Village Spectator today.
Now read Ocala Downtown newspaper online. That was the sound of a tree falling. It could be your tree. You're going to have it trimmed, but never got around to calling Pride Tree Service. It could have fallen in a field, and now all you have to do is call Pride Tree Service, and they'll have it quickly out of the way for a great price. But don't wait until the tree falls. It may not fall in the field. It may hit your car, your house, or worse. So call Pride Tree Service today and avoid all those headaches before they happen. Pride Tree Service, 840-0750. That's 840-0750.
All right, 22 minutes after 11 o'clock. Thank you for tuning in. You know, part of our job really is to make sure that the listeners know what our guests have to offer that will benefit them. and yet, sometimes we're so fascinated by what a guest does, we forget to go there. So this next part, we want to make sure that our listeners know what Dr. Gowda can do for their pain, specifically back pain. So let me reintroduce Dr. Ranjit Gowda. He's in the studio. Leah Caruso is in the studio. You all know Leah. She's in here every month or so, or something like that. And with Strive Rehabilitation, Dr. Gowda with Strive Pain and Spine Center. So were you just talking to Joe about his back pain, or did he not mention it? You guys were talking. I wasn't eavesdropping.
Yes, he was talking.
He's got
about
some back pain.
So we're talking about everybody's familiar with Joe, I suppose.
Yeah.
Yes.
So do you treat back pain differently than you might have done, let's say, 10 years ago?
Think I would, in some ways, yes. In this past 10 years, back pain treatment has kind of sort of stabilized, I would say. If we took the time period prior to that, I would agree that things were still in transition in terms of the entire matter. But now it's, I think back pain used to be one of those that would depend on who you went and saw first for the problem.
Really?
That still happens, but tends to be a little more organized now in the sense of, so let's say for the example of surgical or non-surgical. We turn back the clock of time 25, 30 years ago, we would see a lot of the conditions today that are treated non-surgically be treated surgically rather early on for a disc injury or a disc herniation. But in today's world, or in the past 10 years, the standard of care have been established even for back pain, and we understand that a trial of conservative management or non-surgical management and the best faith efforts to make this better without needing surgery is the most appropriate course in the long run for the person. As in the example of, say, the study showed that 10 years down the road, a person not having had surgical management generally has less back pain and does better than the one.
Wow, really?
It may not be much of a difference in the first year or two that a surgery might be of more immediate relief. That being said, there is a place for surgery too, which should not be delayed beyond the point of being necessary, but the judgment call should be made on an individual basis. So I don't want to generalize that somebody needs or doesn't need surgery, but even those cases that would have had surgery right off the back in the past are now, we understand they're best served by having, for example, physical therapy or and conservative management, and we all heard about epidural injections or steroid injections, and that is what Joe was talking about, that he has had 2 on one side and needs to get 2 more on the other.
Robin's husband also had some kind of, he called it concrete or something, right? What did he have?
Yeah, he had his discs had to be fixed, so they did a couple injections and they made him stable.
That's right, and I don't know the full detail. From what you're suggesting, it seems like somebody might have done what's called a vertebroplasty, where artificial bone or cement's been injected, and that's necessary for where we have compression fractures. Or
So is it similar? Is the non-surgical remedy for back pain similar to chiropractic approach or acupuncture approach or acupressure or anything like that?
Yeah, non-surgical in a sense even would mean all things short of surgery in the way I see it. In surgery, for example, would start with simple things, time itself being one non-surgical management, where a lot of back injuries do heal up. It may be a simple pull, or we all have had a pull or a muscle sprain, and we don't necessarily go to a doctor's office.
Okay, so a pain doesn't necessarily, a back pain could be muscle, it could be bone, or like in Robin's husband's case, actually the
fractures.
Okay.
Yes, that I mean it goes. Yes, that's true. Back pain could be any, and it could be the simplest of causes, like a muscle pull. The question where the medical evaluation becomes very critical is if it extends beyond the normal, and we can't generalize. It also depends on the level of discomfort or severity or the kind of symptoms we're having. It would, pardon?
I'm sorry, I didn't mean to interrupt you, and I wouldn't even know this word except that it's in the paper that Leah gave us. There's something on here I want to ask you about, because it says to ask you about. Electromyography. Am I saying that right?
That is correct.
What is that? What is that?
I try to explain, electromyography is a study that is a diagnostic study to evaluate muscle and nerves, and put simply, we all are familiar with EKG or electrocardiography, which is where we test because there's the muscular activity of a heart, or the electrical muscular activity, is not something that we can examine by any method of human device, as in listening to or feeling or doing an ultrasound. It can only be done by looking at the actual graphs of the electrical activity.
That's amazing that we even know that.
Right.
Again, that's probably not something we had 30 years ago. I'll use 30 instead of 10. So.
Yeah, the EKG would have been there for, believe it or no, you're right, it would sound that way, but when I did my research, I found that people have gone as far back as 1920s and tried to study the muscle. And that was, in fact, I studied long before the model for the heart was set up, in the sense of all muscles and nerves are electrical activity. And this was something that fascinated people when they discovered electricity, and they discovered the body had electricity, and they thought everything could be cured with electricity at a certain point in time. But this testing, some form of it, or trying to assess the muscle and nerve function, has been. In today's world, most people understand when we have, for example, I'll give you an everyday example of a carpal tunnel syndrome. People who have tingling, numbness, or dropping things in the hand, and we all understand carpal tunnel is one of those nerves in the wrist that gets pinched or pressed. And this test, so it's a carpal tunnel on one, in modern day medicine, has to be diagnosed by using an electromyography nerve conduction study, we call it. Without that concluding that a person really is basically a pinched or slowed nerves, we can't really conclude that when something is actually, not everything that's white is milk sort of concept. Not everything that hurts in the wrist or hand is carpal tunnel, but how do we know it's carpal tunnel or is something else? So studies such as an EMG would distinguish that, and would also distinguish any other such injury in the body and muscle, and not just limited to carpal tunnel, all the way from the neck down to the toes.
You're a good teacher, too. I like the fact that you use metaphors.
Oh, there you go.
Everything that's white is not milk. I can understand that. Doctor, thank you for coming in here. Leah, thank you for bringing Dr. Gowda in here. Before we say goodbye, we got, 20 seconds. What's the phone number we need to call?
For Strive Pain and Spine Center, the number is 352-690-7777.
All right. Leah Caruso and Dr. Ranjit Gowda. Fascinating stuff. Thank you for coming in today.
Oh, thank you for having us. And and education is all about the main thing. I think Dr. meant at one point being a teacher of health conditions, and we barely find time in today's world to dedicate enough time. But I strongly believe involving a person that I'm treating in the educational process is critical. Some people care a lot about it, and some say, you do your doctor thing, just
get me better.
Wow.
All right,
that is true, because one of my professors once taught me the most important thing to ask really is, what do you do for fun? And he would always amaze me, because in the rest of medicine we go say, how are you, what's bothering you, or what's your blood pressure, what's your cholesterol, what's up, what's down.
Right.
And he taught me the lesson in rehab medicine that the critical question is, what do you do for fun? Because that's where we need to get this person.
You go to radio shows.
That's right.
And I put another way, I try to ask, like, what would you rather be doing than be here at the office? Because nobody wants to be at the doctor's. And there we have the answer of where we need to get them back to. So.
Thank you. We just blew off the news. We'll be right back.
Wifey only wanted a nice card this Father's Day, so she went to Golfsmith and got the new tailor-made AeroBurner iron set and a free $100 gift card. He was overwhelmed by the thoughtfulness of the card and couldn't really blame her for keeping the irons for herself. Hurry into Golfsmith from now until June 28th and get a free gift card of up to $100 when you purchase a new tailor-made AeroBurner club. Golfsmith, anything for golf.
Overturned truck, freeway construction, rubberneckers slowing everything down. I travel for work. News like that used to ruin my whole day until I discovered Citrix GoToMeeting. With GoToMeeting, you can meet from anywhere using your computer, tablet, or smartphone. No expensive travel required. And with HD video, simply turn on your webcam and it's like being in the same room, which means you can stay productive no matter how bad the traffic gets.
Visit GoToMeeting.com and start our free 30-day trial.
Want to learn more about your furnace or air conditioner? Tune in this Saturday for free tips and expert advice on how to get the most out of your heating and air conditioning system. Or get a free AC rejuvenation by being the first person to go to cleanmyac.com. That's cleanmyac.com. Saturday, free tips and expert advice how to get the most out of your